She was born on August 24th, 2014 at 1:40 in the morning. Her name's Mackenzie Lober, and she's 3 months old. Well, we got a call. I actually got the phone call. Austin was not home, and the doctor called me and said your daughter has cystic fibrosis, and she also mentioned that this is her first cystic fibrosis patient she's ever had in 21 years that she's been a doctor. So that was hard to hear.
Cystic fibrosis is a genetic disease. It's what we call homozygous recessive, and so that you have to get one copy from your mom and one copy from your dad. It's on chromosome number 7, and it's in the cystic fibrosis CFTR gene. It's a certain gene on chromosome 7, and there are lots of different mutations in that specific gene that can cause cystic fibrosis. The underlying problem with cystic fibrosis is how you get chloride out of your cell. You have certain channels on the cell wall that allow chloride out, and with cystic fibrosis that channel is either not functioning or not present, so you have a harder time getting chloride out of the cell. The problem with not being able to get chloride out of the cell is that you can't get water out of your cell either, because water will follow chloride.
Without treatment, it can go a lot of years without really noticing anything. But the bad thing about cystic fibrosis and any really chronic disease is the sicker you get, the worse you feel, until there's a point where you don't remember when you felt well.
So the main problem with cystic fibrosis in the respiratory system is that your mucus gets dehydrated and it gets very thick and sticky. And mucus is the perfect place for bacteria to grow, and so you get recurrent bacterial infections in your lungs, which causes lung damage, and it's kind of a slow and progressive lung damage.
So how we start off Mackenzie's day is we do these things called chest physiotherapy, and Austin and I call them exercises. We put Mackenzie in these different positions, and it's targeting different spots on her lungs to airway clearance, so it's clearing up her airways obviously, and we use this, and we put it in different positions on her, and it sounds like this on her body, and it sounds worse than it is. It's really helping her, so.
My family's been really supportive, and I realized that really quickly. Family is really supportive in it and letting us know that we're not alone. So.
Someone who's brand new, who's just born, a lot of my work is really focused on the parents, because right now it's very much, or typically, a surprise when you are a new expecting couple and you have a baby. There's typically no warning that your baby is going to be born with cystic fibrosis, and a lot of people find that new diagnosis kind of changed the way it's like, whoa, this is life changing. It's not what we expected. And so it can create a lot of different types of emotions for parents that are kind of hard to talk about,
Still hasn't hit us all the way. I feel like it won't ever hit us. Dang it! But it's really devastating. So.
Most of the time you expect a new baby and all that excitement and the joy of having a new baby. Sometimes when they are diagnosed with something like cystic fibrosis, it can kind of add some sadness to a parent's experience. So just trying to be able to help them through that, let them know that that's okay, but also to give them hope and that this baby is still going to do all the normal things that a little person is supposed to do.
Well, I see Mackenzie in 10, 15 years. I see her playing sports, thriving in school. I see her not letting cystic fibrosis take over her life. And hopefully we have a cure in 10, 15 years. Hopefully CF stands for Cure Found.